Peripheral artery disease is a condition where the arteries that supply nutritive blood to tissues get occluded, thus the tissues start starving for essential things such as oxygen. Well, actually about 1 in 5 Americans over the age of 60 has some form of peripheral artery disease, so it is not an uncommon condition. People as they age are more at risk for developing peripheral artery disease, also those with a history of diabetes, kidney disease, certain disorders with your lipids, hypertriglyceridemia, elevated cholesterol, people that are obese, people with a history of hypertension and smoking, all are at risk for peripheral artery disease. Male patients tend to develop peripheral artery disease sooner than our female patients. Most people with peripheral artery disease are actually asymptomatic. However, some of the early symptoms are people may experience pain or discomfort in their leg when they're trying to walk, especially if they're walking up a hill or carrying certain items that add extra workload for those muscle groups. In the more advanced stages, people start developing pain in their foot when they're at rest. Well, PAD is diagnosed by a good history and by a physical exam, really feeling the pulses in a patient. Most people, you can feel the pulses all the way down to the feet. If I can't feel those with my hands, I can then move on to what's called diagnostic vascular laboratory testing, and it's simply blood pressure tests up and down the leg. Finally, if we really need anatomy, very detailed anatomy, occasionally things such as MRI or CTA, CT angiogram, or magnetic resonance imaging are appropriate. And our best test is really what's called angiography, where we inject small amounts of dye through a catheter and look at the arteries, and that allows us to see specifically where the blockages are, even occasionally to treat these blockages. The most important treatment option is non-procedural, that is managing things that accelerate atherosclerosis, and those are lifestyle modifications. Appropriate medical therapies can be important too, drugs such as statins and antiplatelet agents. Whenever people have the pain in their leg with walking, there are medicines that are appropriate for select patients that can help them walk a little farther. And then finally, we do have procedural options here at the Brigham and Women's Hospital for managing peripheral artery disease. Some of those are catheter-based, where we do balloon angioplasties and stents to treat the blockages that are focal in the blood vessels. Occasionally, we also do bypasses, and that involves small incisions on the leg and taking an artery or taking a vein or an artificial graft to bypass actually physically around the blockages. If you ever get in a situation where you have PAD that's difficult to manage and impacting your lifestyle, or even leading to the early signs of critical limb ischemia, a non-healing ulcer, people with diabetes are especially prone to that. It's important to have a team of experts like we have here at the Brigham and Women's. Vascular medicine, cardiology, podiatry, endocrinology, nursing, vascular surgery, cardiac surgery. That team approach, I think, really has been demonstrated to lead to better limb preservation and better outcomes in the management of PAD.